The 42-year-old says it's unclear how or when she got the potentially deadly liver disease, but she was thrilled when the Food and Drug Administration recently approved the drug Harvoni, a daily pill shown to cure hepatitis C in more than 90% of patients. But the drug is expensive, costing nearly $100,000. Shima's insurance company, Anthem Blue Cross, sent her this letter refusing to pay for the drug since her liver is not scarred enough.
When your health insurance carrier wants you to pay your bills, they are going to live in your soul until they see every last penny. However, when you're expecting that same firm to pay your bills on time, or maybe even within a millennial pace, good luck. Let's dig into this story from one who has experienced the horrors, as a matter of fact. Welcome back to the Newsmax Deputy Health Editor and co-author of the DaVinci Baby Boomer Survival Guide. Nick Tate joins us again on the set. Good to see you again.
You too, sir.
This is interesting because here it is. About 1 in 3 Americans, according to Consumer Reports, received a surprise medical bill for services and covered by their health insurance plan, not covered by their plan in the last 2 years. They get the bill. Nearly 1 out of 4 got a bill from a doctor they didn't expect.
That's right.
And people just wind up paying these bills.
That's right. In 60% of these cases, nearly people just end up paying the bill. This is a new study that really is pointing out one of the big changes in healthcare, and that is with the advent of Obamacare, and we can lay it at the feet of Obamacare. The networks of doctors, the networks of hospitals are really shrinking, and the kinds of things that are being covered are not being paid. And of course, healthcare is one of those things where you don't really know what the final bill is until sometimes weeks or months after it's done. You get it in the mail. Very different from, say, bringing your car in to get it fixed. If you're going in for a muffler, usually the mechanic will tell you it's going to cost me so much money to fix it, but not with healthcare. You get the bill later, and in many cases, that's it's not what you were expecting.
Now, you had a personal experience with this.
I did indeed. In fact, recently went for a procedure, went the distance to make sure that both my doctor and my anesthesiologist, and actually the radiologist, were part of my plan. Made sure that the procedure itself was covered. Had the procedure, everything was fine. A month later, I got a bill in the mail for $4,000. Why? The facility where the procedure took place was not part of the network. Well, I did my homework, because I'm a reporter, and found out that this facility was owned by the doctor, who had a financial stake in it. So even though he told me he was in network, the procedure was covered, all the ancillary doctors and medical specialists were covered, the facility where it took place that he was benefiting from was not. So I won't say I made a scene, but let's say I confronted him and challenged the bill and said
You were perturbed.
I was perturbed, and I told him that I thought that the Board of Medicine in this state and the insurance commissioner would be very interested to learn that this doctor was referring patients who he was telling were in network to this facility where he had a private stake. He forgave the bill and said, don't worry about it, we'll just take what the insurance company will pay. But the point here is that most people will not go the distance to do that because they don't know they can challenge it.
Isn't also one of the biggest things is we in America still see the doctor as the God figure. And we don't want, please don't say anything to the doctor now. It's like, wait a minute, last time I checked, the doctor is still like anybody else. He or she is delivering a service to you for a price, and you are supposed to get what that price is. You're supposed to get your money's worth for it, one way or another.
And I think patients need to start thinking of themselves not as the doctor's subordinate, but as the employer.
Okay.
That's the person who's paying the doctor's salary or bill, or your insurance company is, and you need to make sure that you recognize that and be your best advocate. Challenge these bills. There are some things you can actually do. You want to ask up front what it's going to cost for any procedure, any drug. You want to talk to your insurance company before you do it, make sure that it's covered. And if you have a hospital stay or you have a procedure, ask for an itemized bill that will tell you everything that you were charged for. And many people will discover that they're being charged for services or medications they never received.
And I will say this, the lady Shannon did exactly that when she was in the hospital, and she looked at every single thing and she went, nope, nope, nope,
right.
Yes. She knew what she needed and what was supposed to be on that bill, had it all taken off because they said, oh, that's not supposed to be there, that's not supposed to be there. They'll slide it by you because they think you're too dumb or you're too lazy to look.
There's a debate on whether some of that stuff is intentional to make up the cost for unreimbursed care, and there's an argument to be made there. But I think in many cases it's honestly just a mistake. Either way, you shouldn't have to pay for it, and Shannon did exactly what she's supposed to do.
So what then, about 30 seconds we have left, does the normal consumer and the normal patient do? How do they find out if they're being overcharged, or at least be able to learn how to fight?
Ask the front office in the doctor's office or the hospital for an explanation of the bill. There are many codes where you have no idea what you're being charged for. Ask them to explain it, number one. Number two, if you think it's wrong, appeal it first to the doctor or the hospital. then to the insurance company. You will usually have success there if you argue for at least a reduction of the cost. Finally, you can go to your state's insurance division and appeal it. On the website, if you go to newsmax.com health, you'll see the story with links for how you can find out who that is in your state. And I can tell you that in the DaVinci Baby Boomer Survival Guide, we do provide a state-by-state listing of patient advocacy groups by phone number, email, and website. So you can get these answers, not just from my book necessarily, but you can find out how to get help.
And simple, don't be afraid to ask.
That's the big thing.
You are the employer of the doctor
right.
or the customer. It's a good way to put it.
Exactly.
I mean, God, let's teach people these simple things. Don't forget the book again. Nick mentioned it, DaVinci Survival Guide. Live, prosper, and thrive in your retirement. Pick up your copy. Nick, thank you so much for being here. Breaking back with News Call and those moments when Mother Nature has her say and there's nothing we can do about it.